California homeowners now dealing with rains from El Nino, and
Right.
you have other disasters in other parts of the country, and we have our shares of disaster here. And that argues for in some people's minds, for some kind of centralized government program that handles
Right.
all of that kind of risk. Everybody puts money into it and so forth. What's your thinking about that versus a more decentralized private sector sort of answer to that kind of question?
Well, you know, Steve, we've had in Florida, we've had for many years what we called the hurricane risk pool that became known as Citizens. And somebody would have said years ago, boy, these coastal homes in Florida, the private sector will never want them all. So we collected them all into one pool we call Citizens, and once again, we had to price up, because when you have all the unhealthy patients, you know, if it was health insurance, or you put all the wind risk in one pool, you have to price up for that. So I just look at it differently than those who would want to consolidate all of that. Where there are catastrophic, where the federal government has come in with FEMA after some huge horrific events that were broader in scale than we could have ever imagined, that is extremely valuable to communities. But day in and day out, me being able to insure for the most likely occurrences, the private sector has met those needs, and we in Florida have a Florida Cat Fund that is now fully financed and is available as a backstop. And yet, of course, if there was something beyond our imagination, FEMA would make itself available. But this helps keep costs down by the way that we're managing it today, letting the private sector take more of our wind risk at price points that are not significantly higher that we were worried about. If everybody had to stay in Citizens, we would have had to have priced up, but you move those out into private sector solutions. Now we got to keep an eye on those private sector players. They have to be fair. They have to be there on the spot to pay your claim. If they're not, we're going to hold them accountable.
Are there, at this point, any insurance-related issues that you think could creep in, who knows the future, that could creep into this presidential election?
Yeah, there are, and I think this one that if anybody who's living in coastal areas in their communities, or in the Mississippi Delta, or in Ohio near some of our significant waterways, and is being hit with these flood insurance rates, I'm sure that's creeping into this conversation. What people are finding in the medical health care costs is clearly going to be one of the centerpieces of this administration. And again, I think that proves the point. The promises that were made by, if we could just take everybody into one healthcare system, we could bring rates down, has proved to be completely false. Rates are now moving faster than they had been before. There is less option, less choice, less doctors willing to see you under this plan. So again, I think the public is ready to say, hey, for years, we have been able to shop for consumer needs across a diverse private marketplace. Insurance is not so different. Have the backstop, have the catastrophic funds, have FEMA available to us, but please don't give us one solution, one answer fits all, one deductible, one type of coverage. That's just not the way that is going to meet the needs of millions of different households.